go. There are 182 active cases of coronavirus in Victoria. That's 7 new cases since yesterday's update. Of today's 7 cases, 3 are linked to known outbreaks and 4 are under investigation. 1 case was reclassified. I'm sad to say that there are now 816 Victorians who have passed away as a result of this global pandemic. That's 5 since yesterday's report. 1 female in her 70s, 2 males in their 80s and 2 females in their 90s. 4 of those 5 deaths are linked to aged care, and we of course offer our sincere condolences to those 5 families. There are 23 Victorians in hospital and none of those are receiving intensive care. A total of 2,875,056 test results have been received since the beginning of the year. That's an increase of 16,061 tests since yesterday. That's a very strong number. We thank each of those more than 16,000 Victorians, and we again urge each and every Victorian who's got even the mildest of symptoms, don't wait an hour, don't wait a day. Please go and get tested as soon as you register those symptoms. The time that you are infectious and don't know it is the absolutely critical time. If you are going about your business, even under very strict rules in Melbourne, for 2 or 3 days while you've got symptoms, then you are almost certainly infecting other people. And what's more, if you've got those symptoms, given there's so little flu, there's so little cough and cold symptoms, then there's a very high chance that you've got this virus. So please, as soon as you register those symptoms, please make sure that you go and get tested at one of more than 210 test sites across the state. You'll get your results back within 24 hours. That way we can protect you, the people you love the most, your family, and every family, because we can pull this up and not have people unknowingly infecting others. It's a critically important part of the strategy. Again, let's focus on the fact that more than 16,000 people got tested yesterday and the day before. That's a mighty outcome. There are 16 healthcare workers who are active cases. Of course, we're always grateful to them and their colleagues for their work. The 14-day average to 13 October is 9.6 cases in Metro Melbourne and 0.6 cases in regional Victoria. Cases to the 11th of October that are mystery cases, unknown source cases, 14. Now, in terms of, because I know everyone's very focused on the 5 being the key number in Melbourne, I can confirm that today's Melbourne number, of the 7, 4 of those are in Melbourne. 3 of those are in regional local government areas. In fact, they are in the Shepparton area. And Jerome and Brett can speak in more detail to what has occurred in Shepparton and what our public health response is around that. And that's why the testing commander and the chief health officer are both here today. So 3 in Shepparton, 4 in Melbourne. With more than 16,000 tests, that's a very strong outcome, and one that again gives the very clear sign that these numbers are coming down. Whether they're coming down quite as fast as we had hoped, that's another matter. We'll need to see the days between now and Sunday unfold, but we will have more to say on Sunday about some significant changes. That means the total number of active cases in regional Victoria is 8. That is 3 in Shepparton and 5 in Mitchell Shire. 30 active cases in aged care, and as you know, there are no active cases in disability facility settings. We have essentially eliminated the virus from those settings, which is very important given vulnerability in those settings. Now, in terms of Shepparton, I won't go through all the high-risk sites or the exposure sites, places where we want people to test. That is a very long list. It's here if anyone wants to ask me any questions about it, but what I thought I might do, just before I throw to Jerome to talk about what we're doing up in Shepparton, I might just go to the following points. Golden Valley Health's acute respiratory clinic at Graham Street, Shepparton, is open 7 days a week from 9 a.m. till 5:30 p.m. That's one place where people with or without symptoms can go and get tested. The Macintosh Centre at Shepparton Showgrounds, corner of Midland Highway and Thompson Street, will open from 12:30 p.m. today. Again, that's a place where you can go and get tested in that Shepparton community. And the Shepparton Respiratory Clinic at 172 Wellsford Street, Shepparton. Again, it's open between 9 and 5:30 p.m. today, and from 9 a.m. to 8 p.m. from tomorrow with those extended hours. I understand that GP respiratory clinic is appointment only, I understand, but if Jerome wants to add to that, of course he can. What's occurred in Shepparton will require an urgent public health response, and that's exactly what's been brought to this task. Those sites we could formalise those sites of interest, and that's why notification went out quite late last night. We didn't wait till the morning because we want to prompt people to act. We want people to come forward and get tested. I'm very, very confident. I've had the great privilege of visiting Shepparton many, many times. I know that community, and I know that just like Kilmore, they will respond to this challenge. They will come forward, and the early reports, many people have already presented for testing. That'll present a challenge. There'll be some time taken to move through and process those people, but we're very grateful, even at this early stage. We're very, very grateful for the response that we've received. This will be cases, contacts, and the contacts of contacts that will be tested, that will be isolating, and then that picture will become more complete with more and more people caught up within that as more and more people get tested. But if we want to pull this up in Shepparton, that's exactly what we need to do. And I want to thank all of the Goulburn Valley Public Health team and our public health team more broadly for the very long hours and the very significant attention they're bringing to this, because it is a very important and a significant challenge in that local community. Again, it's probably best now if I go to Jerome just to speak a little bit about some of the efforts overnight and what the coming days will look like in the Goulburn Valley. And then all three of us are here to answer any questions that you have.
Thank you, Premier. Before I turn to Shepparton, over the last 2 weeks, 141,164 people have been tested in the Melbourne area. That's an increase over the last 2 weeks of around 2.7% on the period before that. Over the same 2 week period, 30,478 people have been tested in regional Victoria. That's a 12% increase on the previous period. And again, my thanks to all those people for getting tested over the last 2 weeks, in particular the 16,000 or so who got tested yesterday. It is all about how we ensure we sustain those good testing levels across the board, so we identify where the virus is and how we ensure we stop it in its tracks wherever it may be. Particularly pleased to see some very strong community engagement in some of our key LJ areas such as Brimbank, Hobsons Bay, Wyndham Vale, Frankston, Dandenong and Casey. If I turn to Shepparton, yesterday early afternoon, an individual who had come forward at the weekend to get tested received a positive result. We immediately tested 12 other people at her workplace, a tyre shop in Shepparton, and identified 2 further positives. So as of late yesterday evening, we had 3 positive cases, 9 negative cases in Shepparton, all of them associated with a tyre shop. Yesterday afternoon, we traced back the source of the infection to a Melbourne resident who travelled with a permit to Shepparton on the 30th of September. That was the original cause of the cluster, as we now understand it, within the Shepparton area. And therefore our focus today is about supporting the Shepparton community as to how we respond to both the 3 positive cases we have at the moment, but also, we believe, a number of contacts that could have been made in the last 2 week period. We have identified last night on the website and updated again today, and we will update this numerous times during the day, the current high-risk locations based on the patterns of travel between the 3 positive people and the original index case from the Melbourne area. Again, I won't read out the details, but in summary, they are the Central Tyre Service, the Marupna Golf Club, Bombshell Hairdressing, the Thai Orchard Restaurant, and the Shepparton Marketplace Medical Centre, as well as the Bunnings Warehouse, McDonald's, the Lemon Tree Cafe, all in the Shepparton area. And again, details of all of those are on our website. What we're asking anybody in Shepparton or Goulburn Valley who has visited those locations, what we're asking them to do is to come forward and get tested today. If you have symptoms, if you do not have symptoms, if you attended any of those locations at the times set out on our website, then please we would ask you to come and get tested to make sure we can stop this virus in its tracks. We're also asking all residents of the Shepparton area if you have any symptoms, and in fact we ask this of all regional Victorians and we ask it of all Victorians in Melbourne as well. If anybody has any symptoms whatsoever, please go to your nearest testing centre and get tested today. Do not delay, do not wait. As the Premier has said, any period in which you are feeling unwell and are carrying the virus, you are spreading it to your family, to your friends and to your associates. And the only way we'll stop it in its tracks is by making sure we identify it at the earliest possible state and follow on from there. We are, of course, looking after the 3 individuals now who are now positive. They're under care of Goulburn Valley Health, and we will support them and their families to isolate safely. It's important to realise that anybody who comes forward to get tested and anybody who is being asked to isolate as a close contact will receive support from us, and we will ensure that both their medical needs but also any other support they need is taken care of. So if you're concerned about coming forward because you have wider caring responsibilities or you have other commitments, please reach out to us, talk to us at the outset, and we will support you to do the right thing to isolate for the safety of yourself, your family, and the wider community. We now have two testing centres already operating within Shepparton, the Goulburn Valley Health main hospital, as well as a respiratory clinic. We also have a pop-up site turning up at the showgrounds that'll be open at 12:30 today, and we'll stay there for the next few days. We're also identifying a number of other sites today in Shepparton where we'll develop additional testing facilities over the next few days, and I'll announce those as they become available. Our focus, as it was in Kilmore a few weeks ago, is to ensure that anybody in Shepparton is supported, and if they have any symptoms that they can be tested effectively, and we will work with you over the coming days to ensure we get to the bottom of exactly where this virus has got to so far, and that we can stop it in its tracks from here on in. I would like to thank the team again at Goulburn Valley Health who led all the work yesterday. They had to do some very fast detective work yesterday. We used our rapid molecular tests to get very rapid turnaround results for these first 12 people so we can identify exactly how far this initial outbreak had gone. We will now continue to drive an extensive testing program over the next few days to get to the bottom of any of these outbreak locations and where we go from here. And with that, I'll hand it back to the Premier.
Happy to take any questions you have.
Can we just clarify if the Shepparton testing is anybody who wants to get tested? Is it asymptomatic testing or is it symptoms?
So there are a number of sites that have been, and look, it might actually just be easier to go through those sites again, just if I can get to the right page, sorry. Central Tyre Service in Wellsford Street, Shepparton. And there are times that are associated with all of these. I won't go through those, but if people go to the website, that'll be a prompt. If you were there at any point recently, you can go and find the relevant time period. Maroopna Golf Club Members Bar, Bombshell Hairdressing, Thai Orchard Restaurant, Shepparton Marketplace Medical Centre. Those are, at this stage, the locations that are high risk. There are then locations of concern. Bunnings Warehouse, McDonald's, Lemon Tree Cafe, Maroopna Golf Club Pro Shop. So those are the sites. If you've visited those sites in the relevant time period, and those time periods are listed on the website, whether you're symptomatic or have no symptoms, you're encouraged to come forward. And we desperately want you to come forward and get tested at any of those locations, and the number of testing locations will increase, as Jeroen's just indicated, and we'll update people accordingly on that. So given what's already occurred this morning, since we've called people to come and get tested, very strong response. I'm really confident that we'll get the same result as we had recently in Kilmore, where many people will come forward and get tested, and that is absolutely critical. If there's any further information that we can provide to you guys in terms of getting that message out through your various channels, then we will.
So this is the same Melbourne resident who came from Melbourne to Kilmore and spread the infection there, is that correct?
Melbourne, Kilmore, Benalla, and now it is very clear to us that person was in Shepparton as well.
But had not said that.
We've never walked out of one. We've never walked out of one of these without answering all the questions. So, well, let James do his follow up then, and then we'll come to you, Raph. James.
This person had not disclosed that they'd been to Shepparton.
Correct.
Has also gone and done things in Shepparton that you can't do in Melbourne.
Correct.
Like dining in Kilmore.
Or going to Bunnings.
Gone to the golf club. Bar,
Indeed.
Gone to get a haircut. Should this person be fined now?
This matter's been referred to Victoria Police. They're the ones who make judgments about what should be fined. That is to say, it's gone to the compliance unit within DHHS, and they'll provide further information to Victoria Police, and then they can make their own judgments. I just want to be really clear with people. You don't get in trouble if you tell the full story. You potentially do get into trouble if you don't. And by trouble, I'm not just talking about a fine, but there are infections in Shepparton today that we know of, and there's almost certainly going to be more, that were all completely preventable if this individual had told the full story. He wouldn't have got into trouble for telling the whole story. It's only when you don't that we all have problems. We all have a challenge that's greater than it should be. We can't change that. That's why we're focused, night and day to get everybody in Shepparton that needs to be tested, and then to put an appropriate response around those people and to pull this up as quickly as possible. But the message today, Victoria Police will deal with that. That's not for politicians to be doing that work. Victoria Police should. But I just want to reconfirm for everybody, there's no stigma or shame in getting this thing. It doesn't discriminate. But what people can't do equally is discriminate in what they tell us. They have to tell people the full story. And if you happen to have visited a pretty large regional town, to not tell us you've done that is just not the right thing to do. Not for yourself, not for the people that are infected because of that, and all the infections that may come that were all preventable. If back weeks ago, certainly days ago, but I think it is weeks now, we could have done in Shepparton what we did so successfully in Kilmore and in Chadstone to make sure that people knew that they should get tested. We found them quicker. They and their contacts could be away from everybody else. We'll have to see how this runs over coming days. But again, if you tell the full story, you don't get into trouble. It's only when you don't that you cause all sorts of difficulties for everyone and potentially for yourself.
Can I just ask a question about what the driver might have known? I don't know if it's a question for Jerome Weimer or Brett Sutton, but the manager of the butcher shop tests positive on Monday the 28th. On the 29th of September, all of the staff, all of their details are forwarded to the department. On the 30th of September is when the truck driver makes all of that journey. I don't know if Jerome or Brett can tell us, were the families of the staff at the butcher shop, were they told to isolate on the Tuesday? Would that truck driver have known that his family member was staff at the butcher shop, and was he encouraged to not go to work? Can you tell us that?
I'll let others speak to that, but let's get the answer to that. But let's not skate over the fact he did have a permit, right? So it's not a question of you're in regional Victoria and you had no lawful reason to be there. The key point, though, is that things have then happened, places have been visited that are not allowed. You're not allowed to go to Bunnings if you're from Melbourne. The rules in Melbourne follow you, and they follow you for good reason. And sadly, in Kilmore, and we now know in Shepparton, at least to some extent, we've now got a very good example of why those rules should follow you, because Melbourne is a different virus community than what regional Victoria is. On the issue of who knew what and when, I'll let whomever want, Brett or Jerome?
I can do it. Brett, I'll do it.
Go, Jerome.
So in terms of the original Chadstone outbreak, so the driver had not, I believe on the 30th, had been told he had not yet been told to self-isolate at home, is my understanding. I can confirm that offline for you, Raf. What I can confirm, though, is that the driver on the 30th of September was already under any conditions, any permitted traveller into regional Victoria is already under obligation not to attend any local restaurant, cafe, Bunnings or any other retail activity outside of regional Victoria. And of course to practice all the good measures around social distancing, mask wearing, hand hygiene that all of us should do. Clearly there have been a number of breaches of those core principles that led to not only Kilmore. I think the real area of concern for us with Shepparton is that we ended up in a very extensive conversation with the individual on the back of the Kilmore outbreak. At that point, we should have been told about the Shepparton connection that he'd made. Had we known about Shepparton, we would have done in Shepparton what we did in Benalla, what we did in Kilmore, which is to encourage local testing, to test all of his contacts, and we would have jumped on this a week, 10 days earlier.
Okay, so we don't know on the Wednesday, because I was told that his family member gets tested the day before he goes for a drive around regional Victoria. But
Yeah.
obviously
So let us deal with that.
Okay.
Let that question on
So he
notice.
speaks to the contact tracers presumably by Friday the 2nd of October, because you contact the Oddfellows Cafe the day after.
Yep.
When he spoke to the contact tracers, did they ask him for a log from his truck or any other evidence of where he had been other than the interview?
So he was asked for an extensive detail of every single action he'd taken on his previous few days, not just within regional Victoria but also within Melbourne. He disclosed the activities he undertook within Kilmore, and he disclosed a stop in Benalla at the White Line Tyre Service up in Benalla. He did not disclose any activity around Shepparton.
I understand that, but did you ask him for, can we look at your phone? Or I don't know if he's got a diary in his truck. I just want to know if he was asked for any back up evidence for where he had been?
Not to my knowledge.
Could you
And,
ask?
sorry, can I just do one more
Yep.
follow-up? As far as I'm aware, I don't know if it's the State Controller or the Chief Health Officer, you can issue a direction to say hand over your location data from your phone. You don't need to ask the Premier for those powers, you have them at the moment.
That's right. I can refer that to the Chief Health Officer.
I just
Can we
want to
do
know if you might do that next time.
Yeah.
Are we heading to a place where you might ask for people's phone data because you've got that power to do it?
Yeah, I think so. Firstly, point of clarification. So some of these exposure sites don't relate to the index case. So people who are visiting the golf shop or some of those other cafes and restaurants relate to these latest cases and not to the case who travelled on the 30th of September. In relation to validating some of the information we get, of course we rely on people to tell the truth, and we really emphasise how critical that is. And it's not to emphasise that you can catch people out, but the reality is if there's another cluster that emerges and someone says, oh yes, I saw X, Y and Z, you'll be found out. There is no reason not to tell absolutely every truthful element about where you've been, whether or not you've been working on particular days and where, and all of your close contacts. Because if those individuals become cases, they're at risk, their families are at risk, their workmates are at risk, and anyone else they come in contact with are at risk. So I really want to emphasise that just being honest with us and giving the full and frank account of all of those elements are really important. In terms of protecting regional Victoria, I spoke to a number of MPs yesterday across Victoria. I am in no doubt about their fierce defence of the kind of COVID-free status of regional Victoria. They want to get there and keep it that way. They represent their constituents with a fierce determination to make sure that this virus stays out of regional Victoria. And so I have no doubt that the people of Shepparton will step up in full and will get on top of this, because everyone will come forward to do the testing that we're asking of them, and that they'll quarantine, and that their families will quarantine at the same time if they've gone to those close contact sites. In terms of getting all of that information, if there's any doubt about the full account that people are giving, there are powers in the Public Health and Wellbeing Act for me to request information, demand information for the purpose of assessing a public health risk, and I'll absolutely consider that in circumstances where that might not be forthcoming.
Humans are fallible. They might not always be honest about their things, not because they want to lie, but maybe because their circumstances don't allow them to. So instead of sort of assuming everyone is being honest with their account, why not assume that everyone is not being honest with their account and try and get the evidence to back up their
Look, I
claims?
think we are. I think we're assuming that some people will give a full and frank account of where they've been and when, and others will not, for a number of reasons. And again, I recognise that there are issues that sometimes relate to a person willfully hiding stuff, and others who are genuinely fearful of consequences. With respect to visa status, a lot of people have fears about what it might mean for their work. They should all be reassured that no employer has a right to sack you, to stop giving you hours because you become infected with coronavirus and subsequently recover. You have all of the normal entitlements of work that you have now. So yes, we will work on the basis that we need to continue to go back to people to try and clarify information, that we need to engage with them as constructively and as supportively as possible to get that information, and that there will be circumstances where we need to double check it. And if we've got that suspicion that information is being hidden and there's another mechanism to validate that, I'll absolutely use those powers.
But contact tracers are human as well, they might be amazing, they might be able to read people's emotions and thoughts, but we know with this Melbourne case who travelled to Kilmore and then to Shepparton, there was no suspicion that this person wasn't being completely honest. So why not start from the premise of just double checking evidence and just, going back to them to clarify and getting them to, I don't know, phone logs or whether it's like truck logs or whatever it is, just starting from that basis as opposed to relying on suspicion.
Yeah, we will have to consider that. I think we'll have to use every tool at our disposal. We don't want people to withhold information because they're in fear that we'll investigate other data that they don't want looked at. So there is a balancing act there as well. But if we have to interrogate phones for GPS information, those powers are available and we'll consider them.
The balancing act is so many people in Shepparton, even in Kilmore, there's hundreds of people in isolation. Potentially the same thing is going to happen in Shepparton. So the balancing act, it's not comparable to say, I need your data to make sure that you're telling me the truth, versus we might potentially have hundreds of thousands of people in quarantine.
No, I understand that, and the consequences in Shepparton haven't played out, but we know that there are hundreds of people who are requiring testing, who'll be anxious about their risk, and who may end up being positive. We have to balance the willingness of people to declare anything about whether they have a phone, whether they took the phone with them, whether they'll be prepared to hand it over, or we need to go to court. So there are elements about establishing rapport and trust that need to be the starting point with everyone. But yes, we will use whatever tools are available if there's a need to interrogate further some of that data.
Can we just clarify, once you had those positive results in Shepparton yesterday, how did they then get linked back to this person?
Oh, because we ask every case who they've been in contact with. They've obviously referenced a visitor from Melbourne, and we've cross-checked that.
Can I just clarify the situation in Shepparton? Is it the same as Kilmore? In Kilmore, you've said if you've been to this cafe, isolate, get tested, but also close contacts, also people who share the house. It's not clear to me that that is also the approach in Shepparton.
Yes, for those high-risk sites, we're asking everyone symptomatic or asymptomatic to get tested and to isolate for that 14-day period.
And is that going to be the approach from now on, no matter where you might find an outbreak?
We will always look at the circumstances of particular places, but yes, that is the policy. That's the contact tracing procedure for all of these settings.
It went in the city as well?
Yes.
So if Chadstone happened today, should you be doing asymptomatic testing there?
Well, so we did asymptomatic testing for all of the staff because they're considered more akin to a close contact, even though staff worked miles away from those places that were exposure sites. For the vast space of Chadstone, you're actually not talking about even casual contacts, people who were miles away from the Butchers Club or other exposure sites. It was symptomatic testing because they weren't even casual contacts. So that's a different situation. But when we're talking about these exposure sites that we've listed here, there is that requirement to isolate as a close contact, and we're asking everyone to get tested.
And are you confident you have this person's full timeline now?
We'll look into that today, no question.
Is it established with people at the start of the interview with contact tracers that they won't be fined if they tell the truth?
I can't speak to the exact wording in the questionnaire. I think all of our contact tracers are absolutely aware of the need to engage constructively and to give people reassurance about a whole number of things, but I would have to go to the exact wording and the contact tracing team about exactly what procedure they go through to establish that frank and open discussion.
Was it a mistake not to ask or not to get more information from the cleaner in Frankston? I'm told she didn't tell you she worked at the butcher shop. Was it just looking backwards and with the trying to improve going forwards? Was it a mistake not to check more about her location data?
So again, if there's not open disclosure about where people have worked when they've been infectious, it's a really difficult exercise. We go back to people several times. I'm really reinforcing the need to be honest. There's no punishment for being honest. There's no punishment for being completely open about all of that information that we need. But it's a challenge, and it's not about single individuals. It's a genuine challenge across the board. We've had it for months in this phase of the outbreak, but we will review, as we always do, if there are other ways to get information that we think is not forthcoming.
Can contact tracers submit? Okay. Can contact tracers submit licence plates to police to track where they've been?
So again, in the Public Health and Wellbeing Act, it's not about contact tracers necessarily. They're authorised officers under my powers, but I can share information with relevant agencies, again, for the purpose of determining public health risk.
If you had used the contacts of contacts quarantine approach in the instance with the truck driver, would the truck driver have been quarantined by the 30th?
Yes, but the question that Raf asked, I don't know what the Butchers Club specifically said to employees at that time, and it may well be that families were asked to quarantine at exactly that time as well. In defence of the Butchers Club, all the right things done: cleaning, shutting down, telling all staff to quarantine. So workplaces can do the right thing, but everyone who are family members of workers need to do the right thing as well.
Have you checked with this person's employer where they might have been, and do you have the power to request that information?
Yeah, I can request almost anything for the purpose of determining public health risk. But this will be a power of work today, really, investigating all details.
Have those powers to request changed since earlier in the year? Because I know with Cedar Meats, you cited privacy reasons in saying that you couldn't ring up the employer and ask, was person X at work on this day? Is that something you can now do that you couldn't previously?
No, they're always available powers for the assessment of a public health risk. In the Cedar Meats case, we were talking about a person who hadn't been at work, literally.
But you said at the time that you'd never checked that with the employers for privacy reasons.
That's right, but the fact was that person hadn't been at work. There was nothing to investigate.
Sorry, can I pick up on a point that the Premier had earlier made about referring this case to police?
Well, it gets referred, Samaya, to the compliance unit within the Department of Health and Human Services, and then police are free then to, they engage with that unit on a regular basis, and then they'll make a judgment about what they do, whether they do anything with this matter. Just to expand on something that Brett just said in relation to, it's not so much testing, to Ben's question, it's not so much testing that'll change, because we've done asymptomatic and symptomatic testing all the way through where that's been the most appropriate thing to do. It's more about, I think the default setting is now case, close contacts and their contacts, and then at different intervals testing everybody in those three groups. And then what that might do is then open you up into a whole series of other groups. And to be as clear as possible, that's isolating a small number of people, but casting the net quite widely, and that's the key to allowing everybody else to be more open than a kind of statewide lockdown or a community-wide lockdown. So that's going to be a very big feature. Well, it is already, and it's going to be almost an exclusive feature of what opening up in Melbourne will look like. It is broader, but it is certainly more targeted than having rules that cover the whole field.
Just on the case that's been referred to police, has the crime been lying to contact tracers?
That's whether there's been.
And I'm using the word crime
yeah, sure.
lightly.
Is
the issue him lying to
I don't want to cut across the notion of I don't issue the fines, right? And I don't think you'd ever want a situation where I did, or anybody in my job. Police will look at it, and ultimately it'd be a matter for them. The notion that it's been referred, or that there's information that's been referred to the DHHS compliance team, is unique or different. I wouldn't read anything into that. It's just a matter of course. Victoria Police will do whatever they believe is appropriate in this case. Just on the issue of, can we go further to check and double check and triple check and almost reverse the onus where we assume people are not telling us the truth? I think we just have to be very careful with that. This is a voluntary process in that getting a test is a voluntary thing. I don't want anyone out there listening to this or anyone reading anything that might be written about this tomorrow to be in any way fearful of coming forward. It is a very important thing and a generous thing, an appropriate thing, a civic-minded thing, whatever term you want to put on it, but it is a genuinely beneficial thing for everybody across the state when people come forward. But you've got to tell us the full story. You don't get in trouble for telling the truth and the full truth. What you get in trouble for, and I'm using trouble in the broadest sense as well, Samaya, not just in terms of potential fines and those sorts of things, but infecting people that could otherwise have been prevented from getting this virus. That's what comes from people not telling us the full story. Now, that issue is we'll look and properly understand exactly what's gone on here, and it only unfolded early evening last night into the late evening. As Brett said, there'll be a power of work done today. But on issues, I think Raf asked the question in relation to people's employment. You know, it won't come as a shock to many Victorians, but there are people out there that have got jobs and the tax department doesn't know about it, and there is no employer to ring. There is no formal relationship. There are people who work extra shifts and perhaps the tax department doesn't know about it. This is a complex business. That doesn't explain every case, but we want people to be reassured you don't get into trouble if you tell the full truth. It's only if you don't that there's potentially problems for all of us. So it is very complex.
We've established the reason why you can't fine people during a contact tracing interview who are admitting to breaching restrictions.
Yes.
I guess, is it possible to fine people who don't admit or don't tell the full story in a contact tracing interview?
Well, I think that's certainly more likely, but again, I'm not the one issuing the fines. We want to incentivise people as much as possible, tell the full story. All we want to know is where you've been and what risk you might pose, your presence, your activities, what risk that might pose to others and indeed to all of us, given the case numbers and how much virus is out there is critical in terms of making decisions about what restrictions we ease. So there is no stigma, there is no shame, there is no sense of judgment. To have this virus is not a reflection on you, it's a reflection on the wildly infectious nature of this virus. It does not discriminate, nor will we. But the most important thing everyone who's got this has got to do is to tell us everything, tell us the full story. And look, apart from the fact that that's the right thing to do, it's also the smart thing to do because we finish up finding out anyway. This person did not tell us the full story, and yet we know, because the epidemiology of this and the chains of transmission, they don't lie. They're absolutely accurate, or at least there's a very, very high likelihood that they will be.
Premier, can I ask both you and Brett, please, about the figures overall today?
Yes.
16,000 tests, only 4 cases in Melbourne, which is low, obviously, for recent times. Should we take anything from that, or would that be getting ahead of ourselves?
Well, look, part of the problem is we only do this one day at a time, so it's difficult to know what tomorrow's numbers will be, but if I can just confine my comments to today. Have a look at the last sort of couple of weeks. We've had a couple of outbreaks that have run, we've pulled them up quickly, and we're very grateful to everybody who's helped us to do that. That's what's inflated our numbers over that trend, as it were, into the high single digits, perhaps even lower than that. Whilst I don't know what the number will be tomorrow, I can say 16,000 tests, that's a very strong number. So that's giving you a more complete picture than would otherwise be the case. To have just 4 cases in Melbourne, that's very positive news. But again, all of us, we have to stay the course on this, and we have to keep doing all the things we're doing, which is following the rules, and particularly and essentially, if you have symptoms, you've got to go and get tested as soon as those symptoms become clear to you, even really mild symptoms. It's such a profound thing. If you're spending a day, 2 days, 3 days, in some cases 5 days, with symptoms and not acting, those symptoms are not a call to action to go and get tested, then you will almost certainly be infecting other people, and they will infect other people, and then they will infect other people. And that's where we finish up with these change of transmission diagrams, that from one person comes many, many cases. This strategy is working, and the numbers today validate that. I still don't think that on Sunday we'll be able to go as far and as fast as we'd hoped, but there will be significant announcements.
I'm not sure who this question.
Let's go to Ben and then go back. Ben.
Thanks. I'm not sure who this question is for, but I was talking to a contact tracer who's one of the surge cohort, if you like. So people who are called on to add to the numbers when there's a big contact tracing effort on.
Yep.
And talked about using an app called Guardhouse, I think it is, but the way that it's designed, it does not allow to preference Victorian contact tracers. And she said that, in fact, this week, for some reason, all of those extra shifts appear to have been taken up by Queenslanders. Now, we know that local contact tracing is a priority, and you're very proud of the decentralised effort.
Yep.
Is that something you're aware of, or is that something that can be fixed?
No, but I'm happy to follow it up for you. The notion of using interstate that'll be public health physicians or people that are of sufficient seniority to do that long form interview. That's what's normally been done or been part of a process where we've shared that work. Let me come back to you on the specifics of that, but it's a big team and they're all working very hard. We have been getting some support from other states. I don't know how recent that is, but I'm more than happy to chase that up for you.
Can I ask you a question about the speed of the contact tracing at the Butchers Club? So again, I don't know if it's Jerome Weimer or Brett Sutton, but the manager of that butcher shop gets a test on Sunday, doesn't receive his result until the Monday night, which is Monday the 28th of September. The people he works with aren't contacted until Wednesday the 30th of September. So there's more than 24 hours between when he gets his test and he gets the result on the Monday night. There's then more than 24 hours between when he gets his positive test result and the people he works with are told to go and get tested and for their family members to isolate. I just want to know from either the Chief Health Officer or the testing commander if that's fast enough.
Well, let me say first of all, time from swab, we'll go back the other way. We are obliged to have conducted the often hour-long interview within 24 hours of the test result coming to us.
Yep.
We are then obliged within 48 hours of that same start point to have made contact with close contacts. There is no metric for contacts of contacts because that's new, but again we try and fold that into the 48-hour window as well. In terms of interviews, we are getting upwards of 80% of those interviews done not within 24 hours but within 4 hours. So if you think about 96 odd percent, 90 at least percent of tests are back within 24 hours and the majority are back within 12 and even less than that. I haven't looked further up the timeline. So in other words, we're getting to 80% of people for the interview not within 48 hours but within 28 hours. The 24, and in fact even less than that, will be under 20 hours. As for the specifics of that particular, we don't have that. We can definitely come back to you.
I know it might be really petty and it might be details.
No, there's nothing petty about it. But and if
Chadstone's obviously important. If I could just lay that out again, because
sure, no, I understand what you're saying. I got exactly what you're saying.
On the Tuesday, in the middle of that, on the Tuesday,
yep.
And this is all from the Butchers Club, so I don't know this from the Health Department. On the Tuesday, the Butchers Club say these are all the people who work with the person who tested positive yesterday on the Monday.
Yep.
Those people aren't contacted by the Health Department until the Wednesday.
Well, let's double check that. We've been nothing but complimentary of that business. Let's make sure we're all on the same page in terms of the sequence of events as they see it and the sequence of events as we've recorded it. We're more than happy to try and chase that down for you.
Also follow up.
Sure.
Thank you. In regard to restrictions easing, we know this whole lockdown has been about saving lives because of COVID, but there has been growing criticism from many medical professionals that lockdown life could actually be causing more adverse health effects. Things like breast screenings are down 80%, I think it's 30% for prostate cancer.
Yes.
It goes well beyond mental health. Do you
Yes.
accept that some lives will be lost as a result of the lockdown, or at least that some people will become very, very sick because of that?
I would certainly accept that. These measures, and this is why it's so very difficult to make decisions to impose restrictions like this, they do come with a cost. There is a public health benefit, but there is also costs, and some of those are measured at a very personal level in terms of where the health, both physical and mental, of individual Victorians, their families. There's also then a whole range of economic considerations beyond health, matters of public or if you like, private or personal health. There are issues around. There are many different ways in which there is a significant cost, and that's why no one makes these decisions easily. And to the comment, well, weighing up those matters is very, very challenging. It's very challenging, but there is a good deal of thought, an enormous amount of thought and consideration and judgment that comes to that task. And the reason, I think just a couple of days ago now, that I made some comments that this is not an indefinite arrangement. This is not an academic exercise where unless and until we reach a certain number, we will keep these restrictions on, because at some point, the cost of the restrictions will be greater than the increased risk and the increased challenge for our public health team to keep suppressed the virus if we open earlier than we had planned. So that's one representation, if you like, of some of those difficult balancing acts. We had a lengthy public health meeting yesterday, and I spent a lot of time last night talking to colleagues about these matters, and that's why Sunday will be safe steps. It won't be everything that we were going to do, but we'll try and paint a picture of what the coming weeks after Sunday look like, as much as we can, knowing the very frustrating latency of this thing and that time lag. But yes, Victorians can be assured that many hundreds, indeed thousands of hours have been spent during 2020 thinking about and making these really fine judgments, and they're not easy. And that's why, for instance, there's been extra investment in mental health. There'll have to be extra investment in some of the screening activity that you went to in lots of different ways. And that won't be one budget or 1 week or 1 month. I think that's going to have to be a sustained effort well into 2021.
Access to Beyond Blue was 70 in Victoria was 77% higher than the rest of the country. So do you think it's fair to say that Victoria is suffering a mental health crisis as well as a coronavirus crisis?
Oh, I don't know that I'd necessarily term it that way. What I would say, though, is there is significant pain out there, and there are many people who are approaching mental health support services for the very first time. There'll be others who mental illness is part of their life or a loved one's life, and it will have been made worse during 2020. And then there will be other people who are experiencing really significant mental health challenges that may have required hospitalisation, things of that nature. So yes, there are definitely significant impacts and costs as a result of the steps we've had to take. That's why they're not taken lightly, and that's why they'll be on only for so long as they are proportionate and only for so long as they are delivering the outcome. That's why, particularly as we get closer to Sunday, the notion of being able to reconnect people, albeit with rules and there'll be a framework, but the notion of filling in some of those gaps in people's day-to-day lives, some of the things that people have been yearning for, longing for the most, will be very, very significant. Now, I don't expect everyone to necessarily be cheering about it, because people will say, that's terrific, what about all the rest of the rules? That's perfectly fine. But the job we've got is to make sure that we take steps that are safe and steady. And that is really difficult, because you would love to take all the rules off.
You don't think it's reached a crisis point?
Oh, well, many of our mental health... Well, perhaps I answer it this way. I think the mental health service system in Victoria has been in crisis for a very long time. We've called that out. We're having a Royal Commission, the first in the country. They've provided one report. They'll provide their final report in February. And yes, there's a massive job of work to be done to make sure that we don't just have individual services, but we in fact have a system that can support people, regardless of the cause of their mental ill health, regardless of the nature of that mental illness. This is everybody's business. 1 in 5 of us can be expected in any year, not necessarily 2020, in any year, to need mental health care. To them, to carers, to loved ones, and to all of us, given that it doesn't discriminate, it's really important that we get this job done. And there will be a significant job of work to do next year, and perhaps even beyond that, whether it be our kids, people who are experiencing mental health issues for the first time, or those that their underlying condition, if you like, has been made worse by this. It's a big project.
Given you've said previously that lockdown isn't an indefinite exercise, don't Victorians deserve to know the point in which government decides that the lockdown has been going too long, and will you announce on Sunday a point in which it's, I guess, agreed upon that these lockdown measures have been going for too long?
Well, we're not at that point yet, because we still haven't got numbers down. But on Sunday, sorry, just to answer your question, on Sunday, we'll have more to say about what is changing, if not midnight that night, then the following day. And we'll also, to the best of our ability, with all the unknowns in this and all the latency in this, we will try and give people an updated picture on what we think the days and the weeks beyond Sunday look like, as best we possibly can. We want to be as clear as possible. And look, some of these challenges and what's got to be navigated is the direct result that we listened to the community and we said, look, people were very clear with us. We want numbers, we want targets, and we want dates. And we've gone and put those forward as best we possibly can. And that then means you have these challenges in terms of how do you reconcile those, and how they're obviously markers of a point in time, and it's all fine if you meet each of those targets, but if you don't, then we have some of these challenges. But I think it's far better to try and be as clear as we can with people, and that's exactly what we'll do on Sunday.
Treasurer Josh Frydenberg is pleading with you publicly to reopen businesses. Will you be taking in the federal government's considerations on Sunday?
Well, we'll be taking the considerations of public health experts into consideration on Sunday. And I spoke with the Prime Minister this morning about a number of issues, and he didn't raise with me any of the criticisms that Mr Frydenberg thinks is appropriate to run, publicly. I don't know that those interventions are particularly helpful. There's a clear strategy. He's entitled to his view. He's entitled to say whatever he wants to say. But the Prime Minister did not take the opportunity when we spoke this morning to run that argument to me. I don't know. I'm really not interested in talking about Josh Frydenberg any more than I already have.
Listening to the community.
And I will yet again, but I will yet again make the point. I will yet again make the point that politics, whether they're out of Canberra or out of Spring Street, they don't work against this virus. They just don't.
Just, you said you would be listening to the community. New polling data shows that support for lockdown has dropped. So
I don't think anyone's enjoying being in lockdown, and I'm not at all surprised with the results in that that are published today. That's why we are very clear with the community. These rules will be on only for so long as they are needed to make sure that we can deliver the National Cabinet agreed strategy to suppress this, to get it low and keep it low, to open and stay open. These are obviously complex matters, but the principle is quite simple. If we're going to open and stay open, find a COVID normal and lock it in, then there's only one way to do it, and that's not to be giving in to the loudest of voices, as you've just referenced, not this question, the one before, but listening to the community. It's a big part of my job. I've always done that. But at the same time, this is not about being popular. It's about getting the job done, and that's what we're all determined to do. But I fully acknowledge, I'm a member of the community too. I live in a family, I live in a neighbourhood, I get plenty of feedback. No one's enjoying this, no one, myself included. But no one will also enjoy opening up too soon, and then this thing gets away from us again. And then everyone will be, quite rightly, they will say, well, what was all that sacrifice for?
Just on the case contact, close contact feature, that's going to be a feature of the pandemic moving forward.
Yes.
Will close contact of cases also be required to isolate, even if their initial test result comes back negative?
I think it's a case-by-case basis.
So the case tests positive,
Yes.
the close contact has been contacted,
Yes.
their contact has also been contacted.
Yes.
Will this person be required to isolate even
The person in the middle, the close contact of the case.
the contact of the close contact of the case?
Yeah, so if you think about it as 1, 2, 3. So 1 is the
Yep.
case, 2 is the close contact of the case, 3 is the contact of the close contact.
Yes.
And we will try and come up with a better nomenclature for all of this so that it's a bit easier
So I
to
don't have
explain.
to use-
Colour codes maybe, I don't know, but that's how it was. That's what we were looking at last night, actually, a whole series of... Anyway, what I'd say to you is, and this gets back to some questions that were raised earlier in the week, where there were some people who felt that they'd been given different advice by different people. Yes, exactly, because their status changes. It's nothing you've done changes, but a test result of someone that you are isolating because you had spent time with them. If their test result comes back positive or negative, the advice to you and your status will almost certainly change. There's some interplay between day 3, day 11. There's some interplay as well between... There's always pictures that sit behind this. I'd say, look, people will get advice, and we're trying to move to a situation... In fact, we are moving to a situation where the person that's speaking with you will be someone that you know, someone that you developed a relationship with, someone that's your point of contact as best we possibly can. Or at least a small team of people their job is to manage that group of people that are in the second category or the third, for instance.
At the moment, if you're a case or if you're a close contact of a case, you can access hardship payments.
Yes.
Will that be the case for person number 3?
I'm not quite sure. We haven't settled on that yet, but frankly, if getting a test and isolating meant you missed out on shifts and it was a real barrier to you playing your part in that structure, then yes, I think the answer would be yes. You would get that support. We're all about trying to support as many people as possible, and the cost will be but a fraction of. And see, the whole thing about this is it is an attempt to try and have perhaps some tighter settings in those that are most proximate to an outbreak, that then allows the broader community to open up faster. So the benefits of being open are far, far greater than the costs of supporting people to be part of that model. So I think the answer is, I'm only hesitating because I don't think we've made a decision about it, but I think the answer is almost certainly yes.
I just wanted to ask you quickly about the message you've repeated a number of times today. Just tell the full story, you won't get into trouble. Do you think we've got a problem in that message hasn't got out to the community because we've had such high fines and everyone's quite scared that, look, I might get fined $5,000, and they're not hearing what you're saying is tell us the truth.
Well,
they're just fearful that.
No, I don't think so. I think the notion that you are expert on the penalties, but you've been paying no attention to any of the public messaging, I don't know that quite aligns. The other thing too is that I've been criticised for the fact that I'm not finding people who come forward and tell the full truth. I think that's got quite a few column inches. It's got quite a few minutes on the TV. We have made a decision, and it's in keeping, I think, with the vast majority of other jurisdictions around the world, that the treasure here is the truth, not the $1,600 we might fine you for the fact that you went to a cafe when you shouldn't have, or you went to a Bunnings when you shouldn't have, or you were off visiting someone's house when you shouldn't have been. That's separate though from whatever consequences this particular person's going to face. That's a matter for others. But the key point here is there is nothing to be afraid of. If you've got this virus, then we want to support you and your family and every family. And the only way we can do that is if you give us the full and complete picture. And no matter what you tell us about your movements, you're not going to get into trouble. We just need to know, because that's the most important thing. I don't want to get to a situation where we've got to reverse the onus and we just assume everybody's lying to us. I think that's got a whole range of issues with it. But we do have ways of checking, and this virus has a pretty stubborn habit of completing the picture in good time. But at a law like we are dealing with now, this person's not admitted to having been in Shepparton, but we now know that they were. It'll resolve itself, but it won't resolve itself quick enough, and certainly not as quick as if you tell the truth. So I don't see a connection between those two things.
Can we just ask a few questions of the Chief Health?
You absolutely can.
Ralph, can I just ask it from you? Just one more on the Salesforce contact tracing system that was announced a couple of weeks ago.
The CRM system. Yep.
Salesforce.
Yep, same.
Yes.
Yep.
Will that be functional by the end of this week or very soon?
Let me get an update. It's been tested and rolled out, and I think if we're not already at that point of being end-to-end a data system, then we can't be far off. And the lowercase numbers has meant that we've been able to use that more in real time.
And has there been any, problems integrating that system with what you were using?
No, I think what's happened is they've worked side by side for a period of time. Let me get the answer on whether there's been a full switchover. But what it allows us to do is to have that connectivity of data. Everyone's looking at the same screen, the same picture in real time, whether they're in Shepparton, the outer suburbs of Melbourne, or at Lonsdale Street. Everyone's got that same picture, which is very, very important.
And can Queensland access?
No, that's a slightly different task. So just to be clear on that, Alan Finkel, who we're very grateful to for the work that he does, he was tasked at the last National Cabinet meeting with going and seeing what could be built. So that's something that would sit above all of these state-based systems and could reach in and get data on a person who was, for instance, at a border wanting to cross over, or at an airport wanting to get a boarding pass, a system that would be able to reach in from Queensland data and tell you a story about a Queenslander who was in Victoria, or vice versa. That's a different process. And I assume we might well get an update about that on Friday when National Cabinet meets again.
I understand there's a possibility that some of the police who have been working in the one remaining COVID hotel have also still been working general duties shifts in the community. Are you aware of that?
I'd have to. I'm not, but I'd have to refer that to Victoria Police.
How concerned would you be if that were the case?
I
Given
think I'd wait. I'd be concerned to establish the facts first.
Can I just clarify with the driver? After they were interviewed about going to Kilmore,
Yes.
was there extra work done to verify their identity with their employer, with the logs at all, or was it just based off that contact tracing interview?
Well, we wouldn't go and verify his identity. He would have.
So to verify his movements.
I'm not sure. I think Jerome's already taken a couple of those matters on notice, but there'll be a lot of work done, further work being done today, to go back and test and retest everything that we've been told. I think it's fair to say.
Can we just...
You were going to go to Brett. I'm happy for Brett to take over.
I know, may as well finish with Premier, why not?
Why not? That's fine. Any more?
New South Wales border, have you spoken with Gladys Berejiklian about that?
No, I've not, but I've had...
There's your own problems right now, I understand, but have there been discussions around opening the border?
Well, I would just say on that point, you've given me an opportunity. In my dealings with Premier Berejiklian, I've always found her to be a person of absolute integrity. That's the person that I know, and the colleague that I've worked with. That's very, very obvious to me. In all my dealings with her, she's been a person of absolute integrity. On the issue of have I had a recent discussion with her, no, I think you assume correctly. We've both been very busy for lots of different reasons, but we'll talk soon about that. And I think that, notwithstanding Shepparton, the lower case numbers in regional Victoria, I think there's a very strong likelihood that we can move to a freedom of movement for 1 million or so regional Victorians into New South Wales and into South Australia, and vice versa. And I think that's a very good thing. And that will only be bettered, of course, by Melburnians being able to do the same. And that's why we have to stay the course on this and get these numbers down even further. Any other issues for me?
I was going to say, are you considering any sort of localised lockdown or restriction for Shepparton? Is that on the cards at all?
Well, no. This is a key point. So, instead of doing that, what we are doing is we're saying cases, their close contacts, and then one further jump out, their contacts, all isolate for the 14 days. We do testing along the way. We rule people in, we rule people out, and that way Shepparton can stay open. Now, I can't rule out that we might do something broader if we really felt we needed to, but the approach we've taken with those three groups, that's what makes more likely that you can avoid having to do suburbs or postcodes. It's a much more targeted way of doing it. It does cast the net wider, and I'm not for a moment pretending that people who are contacts of contacts who might be otherwise healthy having to isolate something they'll enjoy. That's why we're so grateful that they're doing it. But that's a better way than saying, okay, here's an entire postcode or an entire city that we're going to close. So that's the basic logic to it. And it's worked in Kilmore, it's worked at Chadstone to a certain extent where it was relevant there, and I think it'll work in Shepparton too. But it all starts with, much like every day when I stand here and talk about every element of this virus, it all starts with getting tested. So anyone who's been to those sites at those times, symptomatic or otherwise in Shepparton, please come forward and get tested at those three sites. There'll be further ones announced soon. And anybody in Shepparton that's symptomatic, regardless of whether they've been to any of those exposure sites, please come forward and get tested, and don't delay. Please go and get that test today, and we'll get you a result tomorrow, and we can wrap a public health response around you and your family and every family, because you went and got a test as soon as you had symptoms. That's the key. Do not be waiting 2 or 3 days where you are essentially at very high risk, almost certainty, of spreading this to others. Now it's for the Chief Health Officer to finish it. Yes?
Yep.
Brett.
The Premier said yesterday maybe 5's the new 0 and 10's the new 5. Are you open to new higher thresholds?
Oh, we have to remain flexible and open to the reality that we find ourselves in. That's what our daily review of epidemiology entails. Where are we? Where are we headed? What are the barriers? Can we get there? We'll have to look at that trajectory in coming days. I think it's, as James pointed out, today's a good day. 4 cases and 16,000 tests is a terrific rate, and I'm still confident that the challenge that we're in right now is about complex community outbreaks, but aged care is we're getting on top of that completely, and this is a shorter term challenge. We've still got mystery cases coming up, about 1 a day, that's a concern. That's chains of transmission that haven't been identified. So those high testing rates are really critical, and we'll follow all of that. But if we have to get to a point about making judgments on exactly where we're at and what next steps we need to make, we'll do that.
And the Premier also said yesterday that it's a higher risk, which you've both said a few times. But what does that mean? If you've got a higher threshold, higher risk, what does that mean for all of us?
It's the risk of a really significant increase in numbers in incoming weeks, and this is what is part of that balancing act, that awful balancing act that we've come to. Yes, people have had diminished access to cancer screening services. They shouldn't at the moment. We're telling people to access care, access cancer and other screening services because we're at a point where people can do that with absolute confidence, and it's really important. But you can imagine what it would look like if we have 10,000 cases a day and people are genuinely in fear, and those services are genuinely in fear of having that close contact with clients, with patients. So, the decisions we make now are also about weighing up that risk of what a third wave would look like and the probability of it occurring. And so, yes, if you ease at a point where mystery cases are still at a higher rate, if daily averages are still at a higher rate, that risk is increased.
And sorry, just one more, Rachel. Does the truck driver qualify as a super spreader? Is there enough cases?
Oh, look, I think there's always that combination with a super spreading event, the infectiousness of the individual and the setting that allows a significant number of people to be infected. We're still at a point in Victoria, and this is what we're trying to control here, that we don't have a gathering of 50 or 100 people in close proximity. But yes, a cafe where dozens and dozens of people move in over time and someone's sitting there for a number of hours is that kind of combination between a clearly infectious individual and a number of people coming in contact. But I guess, we've still got limited settings in regional Victoria for a reason. There are, 10 people in a space, up to 2 spaces for a reason. Because if you've got a very infectious people going into a close quarters with 100, it could have been 100 immediate contacts who were positive instead of the few that we've got.
There's been a case linked to Bairnsdale that the Education Minister confirmed this morning, I think was in a teacher at Bairnsdale Secondary College who hasn't attended the campus. But where does that case fit in? Is it in tomorrow's figures? How does it work?
I thought it had already been counted in yesterday's figures, but it was acquired in Melbourne. So the individual had their entire acquisition period, the 2 weeks before they became symptomatic in Melbourne.
And just on today's 5 deaths, how many of those occurred in the past 24 to 48 hours?
I can't tell you.
Did any of them, given that we've had no one in intensive care in recent days?
4 were prior to yesterday. There.
Do you know how long prior to yesterday?
Oh, it'll only be a couple of days. Like, we're getting regular reporting on these deaths, but some deaths are occurring after a very prolonged significant illness, especially in the elderly. So, still a number related to aged care. And even though, aged care outbreaks, the number that are active are very limited now, and the number of active cases within those aged care outbreaks is smaller and smaller every day, there are still people who've had significant illness who are at risk of dying and are dying, unfortunately.
So you're confident that reporting process has sped up? Because I know we had that day where we had 50-odd cases reported, 50-odd deaths reported in the one day, and some of them had occurred, a month prior to
yeah, that was a reconciliation about reporting that hadn't come through from facilities, but we've got a much more routine, almost daily process now.
With this truck driver, Shepparton, has he explained why he didn't tell you about going to Shepparton?
I haven't got that information. I don't know that that we've got that yet, but he'll be re-interviewed, and of course we'll look to that, and we'll want to know if there's any other locations that we need to investigate.
So he hasn't been re-interviewed yet?
He may well have been, probably as we're speaking.
And in terms of linking him to the Shepparton cases, was it the case that people at the tyre business tested positive and you were then able to establish that he'd visited there?
That's right. So those cases that have popped up in Shepparton obviously speak to the close contacts they've had, the people who've come into that business.
Just on the Bairnsdale case, you go, Rent.
I was going to say, can you categorically say he hasn't been anywhere else, or is that still to be seen?
The understanding we have is that the entire acquisition period's been in Melbourne. I think we're very confident that they haven't been in regional Victoria for any of that period of time.
Sorry, I meant the driver. Can you categorically say the truck driver hasn't been anywhere else other than?
Oh no, I think that's that's part of the power of work for today.
So just confirming with the Bairnsdale case, were they infectious while they were in Bairnsdale, and is that why the school wasn't closed?
They hadn't been on the school site at any time, so not an issue.
Just for complete accuracy, sorry Steph, can we call it a super spreading event in our reporting?
We haven't used the term super spreading event. There's no scientific or technical language that really encapsulates that, but it really is a large number of people with that unlucky mix of someone who's very infectious. 70% of people won't infect anyone else. 30% will infect a really significant number. This is how it progresses in these very big clusters at times, and so limiting those opportunities by having smaller gatherings indoors in particular is a really critical control measure. That's what the restrictions have been about all the way along.
And when we were getting into Melbourne's winter, you were worried about the cooler weather and how the virus can stay airborne in cooler weather. Are you what's it going to look like over summer?
I think the key point about summer is that the plan is that we're driving numbers down very, very, very low. And the other thing that we'll look at is maximising, hopefully, it's predicted to be a bit wetter than we might like, but hopefully warmer weather. That means outdoor settings can be the predominant setting for a lot of activity for households, for businesses, to the extent that it's feasible.
Just on masks, sorry, Professor, there's been sort of more anecdotal reports of people wearing them incorrectly. Can you maybe explain to us how that can affect transmission? And also, do the anecdotal reports, I guess, show that there is perhaps some lockdown fatigue, particularly when it comes to wearing masks?
I think people will be fed up with wearing masks. I've seen them worn on chins. I've seen a lot that are sitting below the nose. They shouldn't. That's the issue. You can inhale this virus through the mouth or the nose. And I'm sure that the people of Shepparton will be asking themselves questions. Was I wearing my mask properly right through the time that I was at any one of these several exposure sites? Because it is protective, and wearing it tightly on the nose and mouth together, if both the source case and the person potentially exposed are both wearing masks properly, you really do decrease the risk of transmission by at least 50%. So I think that's really encouraging. It's a reminder why masks are important, and the infectious period of this virus is for the 1 or 2 days before you've developed symptoms, and then in particular as you're developing symptoms for a few days afterwards. So that's why masks come into their own. It's when someone is out and about, maybe before they've developed symptoms, quite infectious and putting others at risk. So wearing a mask protects you.
Sorry to labour the question, but with the Kilmore truck driver, when they admitted that they visited Kilmore, was there any sort of outside work done outside the contact interview to verify where they'd been, or was it just the interview that was used?
It was just the interview that was used. Yeah.
Was the COVID Safe app involved in it? Had that person downloaded?
I don't know for that particular case. We're asking that for every individual. All right. Thank you.
Thank you.
Thank you.
Thank you. See you tomorrow.
Sorry, Jerome, I want to know. It's not a question. I just want to know what we can and can't. I just want to know what we can and can't expect. So that timeline I gave you with the.
We'll talk to you offline about the